Emergency crews take over Boise's VA hospital, a drill designed to keep a deadly disease from spreading and quarantine those affected. Now, you don't need to worry. The disease is not real. The patients are all actors, but the process provides very real practice in the case of an emergency. Jake Melder joins us live in studio with more.
St. Luke's partnered with emergency managers in the valley to put on a mock outbreak of a deadly disease. The illness may be fake, but for the dozens of medical personnel and contaminated people, the anxiety and the fear is real.
All right, so she's at her Benadryl.
Quarantine.
All right, single file.
People raced into tents. A mystery disease is spreading.
We all have rash and coughs and fevers.
The sickness isn't real. The patient's actors, but the scenario is a real possibility after recent Ebola and measles outbreaks.
Those types of events could happen any time, and that's why we continue to exercise this and to work with our partners in emergency management.
Should something like Ebola spread to the States, no one wants to be caught flat-footed. Nurses and doctors go through rigorous training. They wear airtight bodysuits, tracking names and conditions of patients, monitoring symptoms, all under the careful eye of evaluators.
It's just kind of scary and interesting. It just gets kind of nerve-wracking.
More than training for those in the medical field, the event was eye-opening for Boise State nursing student Danielle Morrison.
If an outbreak such as Ebola or anything else is to come our way, if anything was, we have to be prepared for that.
It's also a chance for emergency organizations to get to know who's who and how agencies operate before disaster strikes.
It will be difficult for us if we're exchanging cards on a pile of rubble.
The hospitals and emergency services will now take what was learned from today's exercise and adapt their procedures based on their performance. Live in studio, Jake Melder, 6 on your side.